Hello, in this video, I'll be talking about dairy products and breast cancer. Is dairy implicated in the development of breast cancer? Can you enjoy dairy products after a diagnosis of breast cancer? Before I go on, I want to invite you to subscribe to our channel. We put out 3 new videos a week, so there's a lot of content for you to watch. So one of the things we get asked a lot in our Yerbba YouTube channel comments is it safe for me to have dairy products? Is it safe for me to have milk? Is it safe for me to have ice cream? Is it safe for me to have yogurt, etc.? So I'm going to go over the data, which come from large epidemiologic studies and thus are somewhat fraught with all the problems that we see in a non-randomized setting. So there is a large body of work suggesting that dairy products may be associated with a slight increase in the risk of breast cancer. However, there are just as many good studies showing that dairy products are protective of breast cancer. With vitamin D and calcium, there is some thought that these could be protective and decrease the risk of breast cancer. So as with a lot of epidemiologic work, it's not possible for us to control for confounders. And but what I mean by confounders are other things that go along with dairy products. So people who have a lot of dairy live in parts of the world where drinking milk, especially from cows, is standard, where milk products line the shelves, where drinking your glass of milk a day will help you grow tall. And some of those same factors may be associated with an increase in the risk of breast cancer, like exposure to chemicals over the life course, exposure to pesticides and hormones that are given to animals, to livestock. And it's really difficult for us to tease these things out. In addition, we know breast cancer is more common with greater levels of education, and that's in part due to things like delayed childbearing, which again, epidemiologically is a risk factor. So not having children or having children later in life, which we tend to see with greater levels of wealth and affluence and education, and that may also be associated with other things like dairy intake. So one would not want to say you need to have your children early so you don't develop breast cancer. Similarly, it does not appear that restricting dairy is necessary or even appropriate in people because of perhaps a mild or light connection between breast cancer and dairy products. I mentioned pesticides and hormones a moment ago. There are lots of things given to livestock to help them avoid disease and produce more milk and to be bigger. And some of these may, at the population level, increase the risk of breast and other cancers. Should you switch to organic dairy? Well, certainly that would make sense for your children who are still developing, whose breast tissue is developing. But given the excess cost and the lack of data suggesting that organic products are necessary once we've reached our peak maturity, we don't recommend that. Organic products probably are better for the environment because fewer chemicals are used, which are put into the ecosystem. So from a population and policy standpoint, decreasing the chemicals we put into our world would probably be prudent. On an individual level, once your breast tissue has developed, there does not appear to be any compelling evidence that doing so will reduce your risk of breast cancer. And there are some benefits to the things we find in dairy products. So calcium is normally occurring in dairy products. Vitamin D is usually added because vitamin D does not occur naturally in milk. So dairy products, as well as other things like some orange juices, at least in the United States, are supplemented with vitamin D. So that may be protective for bones and heart and the other things these elements and vitamins are necessary for. And the bottom line is that on an individual level, yes, it is safe to consume dairy. As we say, everything in moderation, with a couple exceptions. I know that some people watching these videos don't believe in everything in moderation, But from the standpoint of medical advice, that has been the safest tack to take. And remember that your own preferences are a big part of what you eat and enjoy eating. I hope it's been helpful. Drop a comment or a question below. We try to get back to you within a couple of weeks. You can follow us on Instagram. You can go to yerbba.com to get your personalized report. Thank you so much for watching.